Hi everybody, thank you so much for clicking on this Hear Center video. My name is Josephine. I'm an audiometrist at Hear Center, and today we're going to be talking about speech, language, hearing, and your child. Initially, when we offered this presentation live, we marketed it as something that would go over milestones in depth. And while we will be discussing milestones, really this is more of a general presentation that covers some of the more basic concepts in speech, language, and hearing. Before we get started, I just want to, again, reemphasize that this information is pretty general and it's going to be geared towards those who don't really know about speech, language, and hearing development. A lot of the articles we used to put this presentation together were from ASHA. ASHA is the organization that's responsible for credentialing language and speech and hearing professionals in the US. We found that their articles were general and informative enough without being too complicated. Although this may not be the most comprehensive guide, we hope it's a good starting point for you as you learn more about speech, language, and hearing development. So Hear Center is a nonprofit speech and hearing clinic in Pasadena, California, where it's our mission to offer comprehensive speech and hearing services to those of all ages. Since 1954, we have offered speech therapy, audiology, hearing aids, and hearing protection to those in the Pasadena area, San Gabriel Valley, Los Angeles, and surrounding cities. Although we really enjoy helping our clients, something that really brings us joy too is our community outreach. We would not be able to offer you these free presentations without the help of our funders, members, and community. So we are really grateful for all the support that's been given to us. So as you can tell by the length of this video, it's going to be a long one. We have a lot to cover, and feel free to pause wherever needed or just jump to the section that is more relevant to you. We're going to be talking about terms and concepts in speech, language, and hearing that we think you should be familiar with. This will give us more context to the rest of the information that we'll be learning about in this presentation. Next, we're going to be talking about milestones in speech, language, and hearing. Later, we're going to be talking about frequently asked questions, stuff that we're often asked about when we deal with speech and hearing. And lastly, we're going to be talking about our services, specifically a special community outreach service that we think can be really great for you if you maybe are considering getting your child's speech or hearing evaluated. So let's start with terms and concepts. So let's consider that Jorge is 4 years old. When he talks, it's hard to understand him, and it's quiet. His sounds don't come out very clear. Vicky is 15 and in high school. Since she was young, she's always had learning problems. Currently, she has trouble with reading and writing and needs extra time to take her tests. Lewis is 12 and had a stroke. He understands the language he hears and can speak in complete sentences, but his speech is slurred and it's hard to understand. These young ones all have something in common: communication problems, but their problems are different. Well, let's look into what makes them different. Speech is how we say sounds and words, and it is the combination of articulation, voice, and fluency. Articulation is how our mouth, teeth, lips, and tongue work together to make speech sounds. On the left, you'll have an image showing how our mouths look like when we make different speech sounds. So on the first row in the top left, the A-E-I, phonetically that sounds like ah, eh, e. And if you make those same sounds with me, ah, eh, e, notice that your mouth doesn't really change the shape too much, and it's kind of in a neutral position. Let's contrast that with the L right next door. So when you say words that start with L, for example, like or love, notice that the tip of your tongue goes to the top of your roof of your mouth, and it hits that very little small bump right before your front teeth. Like. love. This is how our mouth articulates sounds in different ways. And when it's hard to understand children, it could be explained by problems in articulation. Voice is how we use our vocal folds and breath control to make sounds. Our voices can be soft, harsh, low-pitched, high-pitched, harsh, or nasally. Fluency, another component in speech, is the rhythm. It could be the pace, if any speech sounds or words are being repeated. It could be pauses in speech. Anything that relates to the rhythm. That we commonly associate stuttering as disfluency. So we've talked about speech. What about language? Well, language is what we refer to when we choose the words. Language is what we use to communicate our ideas. It's how we combine words to share our thoughts and communicate our needs. Language is what words mean. A star could be a celebrity, or it could be a very bright object high up in the sky. Language is how we make new words. A friend is someone you like, but if we add the ending ly and change the word to friendly, the word now completely has a different meaning. Language is how we put words together, or sentence structure. It's I got a new bike versus I got bike new. Language is knowing what to say at different times. This ties into social skills and social interactions. For example, knowing when to be polite when you meet someone new, or knowing when to be firm when someone is crossing a personal boundary. Within speech and language, a child can have a disorder. When children have language disorders, it could affect one of these 5 categories within language. And these are just the more formal terms that describe, like what I was speaking about in the previous slide, the meaning of words, how we organize them in sentences, knowing what to say at what times. We can also have an issue, we can also have disorders of speech, so how we produce sound, articulation. It could be issues with our voice or just the quality of how the voice sounds. We could also have disorders of receptive and expressive language. Receptive language refers to how our brains process and take in information that we hear through our ears. Expressive language refers to how we share thoughts, ideas, and feelings. It's possible to have disorders. It's possible to have a combination of both receptive and expressive disorders, as well as a combination of disorders in any of these 3 categories. So did you know that there are 3 parts to our ears? Our outer, middle, and inner ear all work together to help us hear. When a child has hearing loss or hearing issues, this could be affected by family health history, ear infections, illnesses such as the flu or chicken pox, traumatic brain injuries, or medications that are toxic to the ears. It's not uncommon for very young children to have hearing loss, hearing issues, or even wear hearing aids or implants at a very young age. Undiagnosed hearing issues can have negative effects on a child's life. When a child isn't able to hear correctly, this affects the development of their speech and language skills. They might not be able to correctly hear how speech sounds are supposed to sound like. Maybe they don't understand how language works or how to use language correctly. Children learn language through hearing and modeling, and hearing loss can get in the way of that, or hearing loss or hearing issues. Undiagnosed hearing loss can also affect a child's performance at school. Subjects can become harder, and there could be definite gaps between children with hearing loss and those or hearing issues from those in the rest of the class. If they can't really hear what's being taught, they're missing out on valuable information to complete assignments correctly. Maybe it even manifests as distraction or kind of being head in the clouds in classroom. I've definitely heard teachers describe children who later had hearing loss to be, they're smart, they just seem off in another world sometimes. Lastly, children may feel left out because they can't connect with others easily. When they have hearing loss, it's difficult for them to truly hear and communicate with others, which can affect their friendships and relationships. And over time, this feeling of disconnect can lead to feelings of low self-esteem and loneliness. How can we see that our children are developing their speech, language, and hearing skills on track? We look at milestones. This section primarily addresses those who are monolingual, but there are some notes on dual language learning and bilingualism that I will address later in the presentation. So we're looking at milestones from birth to age 5 because children develop their language skills at an amazing rate during this time. Their brains become so complex as they grow physically, emotionally, socially, and with language. So when we look at typical or normal development, the range of normal is very wide. Why? Well, it's because children simply do not develop the same skills at the same time. Children come into their development at their own rates. Please remember that all children go through the same stages, but it is hard to know exactly when they will reach each stage. All children have different experiences, lifestyles, and factors that shape their language and development. So comparing your child to another child can sometimes lead to unnecessary stress. But at the end of the day, you know your child best. If something feels off, then it's okay to get a second opinion. But you don't need to get fixated on milestones, if they're missing 1 or 2 skills. That's okay. But let's say you notice that they're missing a lot of skills, then it could be okay to get a second opinion. So from birth to 3 months, from the moment babies are born, they come into the world already communicating with us. They say, "I'm here, help me." And at this young age, they're trying to develop secure connections with mom or caregiver. At this age, babies should startle at loud sounds, quiet or smile when you talk, and seems to recognize your voice. They quiet their crying if they hear you speak. In the talking category, babies will make cooing sounds, and they may cry differently depending on what they need at the time. So if they're hungry, they need to change their diaper, they're sleepy, and they're able to smile at people. This is a way of nonverbal communication. At 3 to 6 months, babies will move their heads towards sound in their environment. They notice that toys make noise, and they pay attention to music. They also respond to changes in the tone of your voice. When they communicate with you verbally, they now can babble in addition to cooing. They can make speech-like babbling sounds such as pa, ba, or me. And they giggle and laugh, as well as make sounds when they're happy or upset. At 6 to 9 months, babies will listen when they're spoken to. They respond to their name, and they understand the word no. When they babble now, there's different intonation patterns, such as baba, mama. I'm sorry, those are the babbling can turn into like 2-syllable babbling, such as baba, mama, with rising and falling intonation patterns. So that's just like baba, mama. At 9 to 12 months, At 9 to 12 months, you'll notice really how far children have come in their language development. They turn and look towards sounds in the environment. They look when you point. They understand that pointing is a way to indicate direction. They understand names for common items. And they begin to respond to simple words and phrases such as no, come here, and want more. They like to play games with you, and they listen to songs and stories for short periods of time. When they talk, they can babble long strings now, like me, me, up, ba, 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 ba. They use sound and gestures to get and keep your attention. They can point to objects and show them to others, and they can imitate different speech sounds, as well as say one or two words like hi, dada, mama, uh-oh. This usually happens around their first birthday, like them being able to say one or two words, but the sounds may not be super clear. At 12 to 18 months, children should be able to follow simple one-step commands such as get the ball, and they can recognize pictures of familiar people and objects. They should be able to speak in one-word utterances, use jargon, which is kind of like babbling that sounds like speech but not quite, and they should have a vocabulary bank of about 3 to 20 or more words. Because they are so young at this age, speech errors should be expected. So at 2 to 3 years old, 18 to 24 months. So at this age, children should really begin to enjoy stories. They can list a few body parts. If you point to their body, they can say arm or leg. They can follow simple directions that have the words in or on, so put that inside or put that on there. They can respond to simple questions. They start to use a lot of new words, and when they speak, they're understandable about 25 to 50% of the time. They may start to ask some W questions like, what's that? Who's that? Or where's Kitty? With the two-word phrases, they can put two words together like more apple, no bed, or mommy book. So now 2 to 3 years, you might notice that children are having a lot more to say during this time. Children understand opposites like go, stop, big, little, and up, down. They're able to follow two-part directions such as get the spoon and put it on the chair or on the table. They understand new words quickly. When they talk, they seem to have a word for almost everything, and they have the capability now to talk about things that aren't in the room. They can use 2 to 4 word phrases. Their speech is understood about 50 to 75% of the time, and they ask why a lot. They can also use words like in, on, or under. At 3 to 4 years old, you might notice that children, it's getting harder to keep up with them. There's a lot of development that's going on physically and developmentally. So at this age, children can respond to you when you call their name from another room. They understand some words for some basic colors, shapes, and family members. They understand how objects work, and they can follow 2 to 3 part commands. When they speak, you can understand them about 80% of the time, and they can ask and answer simple who, what, where, when, and how questions. They can use pronouns like I, you, me, and they, and they know how to they know how to use plural words, so like toys, birds, and buses. They can put 4 words together and make some mistakes. It's okay. They might say, I goed to school instead of I went to school, or I go to school. They like to talk about, stuff that happened in their day, so they're able to participate in conversations longer at this age. At 4 to 5 years old, you'll really start to see just how far children have come in their language development. They can understand words for order and time, such as first, next, and last, as well as yesterday, today, and tomorrow. They can follow multi-step directions, such as put your pajamas on, brush your teeth, pick out a book, and then go to bed, or we'll go to bed. And they can hear and understand most of what is heard at home and school. At this age, you can understand them mostly all of the time, and they may make some speech sounds, but they may make some mistakes, but they should be able to say all speech sounds. Now, this is normal because some speech sounds won't be mastered until they're about 5 to 7 years old. They can talk for much longer in many different ways. They can have different kinds of conversations with you. And when they speak, their sentences are mostly grammatically correct. They can also tell a short story if you ask them to. So that was a lot of information. If you'd like more clarification and information on these milestones, I can link a couple of, or I'm going to link a couple of resources in the description box below that you can look through if you want more information, because I was just reading off a list of milestones, but I think these resources can give you more of an in-depth look that gives you more context. Just for the sake of the length of this presentation, I wanted to keep it a bit more brief, so I recommend that you look through those if you would like more clarification. So yeah, those guidelines, there was a lot that we covered, and maybe parents, something caught your eye. Even if your child is over 5 years old, you can still use these milestones, because the general rule of thumb is that by age 5, whatever skills we saw in the previous slides, they should have sort of mastered it or be able to have done that at that age. So if your child is older and you notice some issues, then that could indicate that something might be wrong. Teachers or staff, maybe you noticed it, maybe these milestones made you think of a child who could be struggling with certain skills. Could they maybe have underlying issues? Or maybe after going through all this, you didn't notice anything abnormal. Maybe you think your child's development is fine, but you want to make sure. So what can we do with this information? Well, remember when I said that HEAR Center has a special community service for you? Well, we want to give you peace of mind. At HEAR Center, as much as we love to help others in our clinic, we want to extend that help outwards to those in our community. So, since 2004, we have offered free pediatric speech and hearing screenings to those in our community, and today we're offering this service to you. So even if you're in the future looking back at this video, this still will apply. We will offer this free pediatric speech and hearing screening for as long as we can. So yes, if you think your child might have issues with speech, language, or hearing, we are providing a free screening to you, and all you need to do for this simple pass-fail test is just send me an email at josephinesariel@hearcenter.org or email at info@hearcenter. We'll take the information of your child, the situation, your thoughts and concerns, and we can see if we can get a screening set up for them. Screenings are great. They're really quick. It's a simple pass-fail test, and if we find that something is wrong, we can discuss our options going forward. So maybe your child might need more evaluation, maybe they don't. So if you would like a second opinion, feel free to give us an email, get the screening scheduled, and we can see what we can do. So let's talk about some frequently asked questions. As I said earlier, this information in this presentation leans pretty general, and it's very possible that you might not get the answers or information you were looking for in these answers, and that's okay. It's kind of hard to give a complete answer for every possible speech, language, and hearing scenario out there, but we encourage you to email us or contact us if you have questions or need more information about a specific topic. So according to ASHA's website, by 2030, English language learners will make 40% of the entire school-age population in the US. Already in California, 60 to 70% of students speak a language that isn't English as their first language. And it's common for parents to worry if their child will succeed as dual language learners. A common scenario in classrooms could be that a child is recommended for speech therapy because they are bilingual and are having academic troubles. The teacher is concerned that the child isn't learning English fast enough and won't succeed at their current pace. Maybe they're even compared to their monolingual classmates, which doesn't feel the greatest. In normal developing children, a second language might appear to slow them down but is it really a language learning disability, or is it just a part of the process when it comes to learning a second language? There are normal processes and phenomena that occur when a child learns a second language. The first thing we want to let you know about is the phenomena known as interference, or also known as transfer. So a child may transfer some aspects of language from their first language, L1, to English, L2. Let's say that the child makes an error in English because of the structures in their first language, Spanish. And I think Ash's website gives a good example of this to kind of clarify. So for example, in Spanish, pardon my pronunciation, esta casa es más grande means this house is bigger. A literal translation would be this house is more bigger. A Spanish-speaking child who said this house is more bigger in English is transferring some structures from Spanish to English. And to those who don't really know about this process, it's easy for someone to mistake it as a language disorder. It's simply a language difference and is a normal thing that happens when children are learning a second language. Another common phenomena is the silent period. When children are exposed to a second language, they can get really focused on listening and comprehending this new language. As a result, children are often very quiet so that they can focus all their energy and understanding. Maybe you've noticed a child at home or in your classroom that is extra quiet. The younger the child is, the longer the silent period tends to last because they're focusing a lot of their effort on understanding language. Preschoolers could be mostly silent for up to a year more, and older children may remain in this period for, excuse me, a few weeks or months. Again, this is normal when with children who are dual language learners. Code switching happens when children alternate within sentences, children alternate languages within sentences. So, for example, an adult speaker might say, me gustaría manejar, I'll take the car. Or a Filipino might say, for my teacher, I have utang ng loob, which means debt of gratitude. So code switching is normal in dual language learning and doesn't usually suggest a disorder. It's just kind of what happens because they are learning two languages. Lastly, for children who are trying to learn English, sometimes they can experience what's called language loss. So the first language, that they were raised with, if it's not maintained or reinforced, if they're learning English, for example, it's possible they could lose skills in that first home language. They could lose fluency. This could be cognitively and linguistically very detrimental to children's learning and to their family life, especially if only one language is being spoken at home. What I will say about language disorders is that if a child does have a language disorder, it will not affect only one language. It will affect both. So that's just something to keep in mind if you think your child might have a language disorder. So what can we do to best support children who are learning a second language, who are bilingual in our classrooms, so that they can succeed academically? A classroom that compassionately supports dual language learners is the best way to help them succeed. And if you do a Google search on strategies to support dual language learners, you'll find a lot of websites with great resources, but we just want to put some few tips here. So when children come to class, they should feel welcome and see their culture represented in the classroom. You want to give children linguistically appropriate activities that are within their language range. You don't really want to give them super advanced assignments that require them to have like a great understanding of English and expect them to, complete the assignment correctly. You want to really match them at where they're at language-wise. You want to observe their unique cues and communication behaviors. Children who are bilingual will often use nonverbal cues to try and communicate because maybe they don't have that speaking component set yet, or speaking component ready yet. So you really want to get down on their level, have an awareness of, what they will use to communicate with you, and give them their full attention. Give them your full attention when you're speaking with them. So similar to the previous point, just encourage them to speak in other nonverbal ways. So children can speak, with gestures, facial expressions, body language. These are all acceptable ways for children to communicate, and helps them feel less pressured in the classroom to speak the level of English that everyone else is at. These strategies can go a long way to support the child as they do a pretty complex thing, which is trying to learn a second language. So, if your child speaks one language, you may wonder, is my child a late bloomer or is there a language problem? So, it's normal for parents to worry if their child is on track, even if they are aware of milestones and understand that every child has their own rate of development. Keeping in mind that there is that range of normal, we can also consider some other language factors, such as what's their natural ability to learn language? Are they in the middle of learning other skills at the time that could maybe compete for dominance as they learn language? How often are they exposed to language on a daily basis? And how do people react to them when the child tries to communicate? Are they ignored? Does someone respond to their communication? On ASHA's website, they give some risk factors to keep in mind if your child is 18 to 30 months and you don't think that they're on track with language. So a child usually understands most of what they hear before they can talk. If your child seems to understand well for their age, it's possible that they might catch up with language, but if you don't think they understand what other people are saying, then there could be a possible delay. I was told that gestures maybe aren't as focused on when examining a child's language, but because it was on ASHA's website, I thought it would be okay to include it here. So before a child uses words, they might use gestures to communicate with you. These include pointing, waving hi, or putting up their arms when they want to be picked up. These are all gestures. So ASHA says that the more gestures your child uses, it could be likely that the language will catch up. If your child isn't using many gestures, it could also point to a possible issue with language. Lastly, even if your child may be slower to talk than others, they should still try to use some new words every month. If you notice that your child is sort of sticking with the same words, doesn't seem to be adding new words to their vocabulary, then that could also signal a language issue. With that said, an important thing that any family can do if they really want their child to develop strong language skills is to be a model of language. Talk to them, read every night if you can, sing. It doesn't have to be difficult. The more language your child takes in, the more likely they'll be able to strengthen their language skills as they grow older. Modeling language is the easiest way to build those skills in your child. So we haven't talked about ears in a while. So why do some children get ear infections frequently? Well, my boss told me that some parents don't really know about ear infections, so I just wanted to take this moment to quickly talk about them. So as we've learned earlier, there are 3 parts to our ears, the outer, middle, and inner ear. And when we have ear infections, this affects the middle ear portion. Ear infections are also called acute otitis media. It's very common for children to get ear infections, and most will have one before they turn 1 year old. And if you've ever had an ear infection as an adult, you know how painful it is, and you can imagine how uncomfortable it is for a child because they don't know how to tell you what's wrong. Ear infections happen in children often because of how their ears develop at that young age. Fluid from the ears cannot drain easily in young children. And just to give that a little bit more context, here's a picture of how eustachian tubes, which is what helps drain the ears, how they are shaped in both children and adults. So if you look on the right and look at the adult's eustachian tube, notice that it's angled downward. So as we grow up, a eustachian tube angles and makes it a lot easier for us to drain the fluid. But in children's ears on the left, you notice that it's a bit more straight. And this is how they get ear infections, because the straightness of the eustachian tube makes it a lot harder for fluid to drain. So the eustachian tube can actually swell up when you have an ear infection, when you have like allergies, or if you're cold with like a flu, or you have chicken pox. And I'm sorry, if they have an infection or a cold, not chicken pox. And when the eustachian tube swells, all that fluid that gets built up can get infected with bacteria and fungi, so that leads to an infection. And unfortunately, it's just the children's anatomy that creates these ear infections most of the time. So some signs of an ear infection in children is that they might be pulling at their ear a lot. They might be crying more than usual. They could have a fever. They seem to have trouble sleeping. And more obviously, you could notice fluid draining from their ears. Ear infections are interesting because sometimes the effects can vary. It isn't uncommon to see perhaps a child having hearing loss with the ear infections. So they could have a hearing problem or not. They could have fluid in their ears but no infection, and they might not even have fever or pain. So as always, if you notice anything off, the best thing you can do is speak with your child's doctor to get their ears checked. They have the means to prescribe, treatment that could help with infection, as well as give you tips on how to better manage those infections. Now, to get to the actual question, why do these frequent ear infections happen? So unfortunately, it could stem from many other things, like just the development of the ears, the frequency of illness or allergies. It could be a lot of things, and unfortunately, we can't give you an exact reason why your child may be having those ear infections, but the best thing we can tell you is to see your child's physician. In some cases, an ears, nose, and throat doctor will, will insert tubes in the ear to facilitate that draining process. Sometimes children need some extra assistance to help the eustachian tube drain better. So lastly, our last frequently asked question: should my child get a speech or hearing evaluation? This is a two-parter that leads into Hear Center services. So for our youngest children, newborns to age 3, sometimes parents will get speech assessments, but because language and the vocabulary in children this young isn't developed yet, they might not be satisfied with how the evaluation goes. So instead, what we're going to do today is look at some early identification signs that children might have a speech or hearing concern, and some strategies that you can do to promote really good, healthy development. So you want to look for the signs. I'll be using ASHA's Early Identification Guide, which includes some strategies to help children, like I had mentioned. And then we'll go into Hear Center screening services. So in language, some things you can pay attention to through your child's development could include if they're not smiling or playing with others from birth to 3 months. They're not babbling at 4 to 7 months. They only make a few sounds at 7 to 12 months. They don't understand what others say at 7 months to 2 years. They only say a few words at 12 to 18 months. They don't put 2 words together at 1.5 to 2 years. They say less than 50 words at 2 years. They seem to have trouble playing or talking with children at 2 to 3 years. And they might have early reading and writing problems at 2.5 to 3 years. So if you noticed any of those signs in your child, what are some things you can do to encourage language development? So you can be a model of that language. As I had spoken about earlier, being a model is one of the most surefire ways that you can help children develop language well. So talk to them, read to them often, and play together. You can also be a really active participant when you communicate with them. Respond when they want to try and engage with you. Acknowledge their interactions and give them your full attention. The only way children can learn new words is if they hear and are exposed to them. So, if possible, use as many words as you can. This really diversifies their vocabulary. As they get older, you can get more complicated with the sentence structures that you use. So you can add more words to them, get a little bit more complicated with instructions. This could help encourage healthy language development. This isn't recommended right now, perhaps during COVID, just for safety reasons, but play isn't just roughhousing and getting down and dirty. It's actually so beneficial because through play, children can strengthen their social and language skills. There's a lot of talking that goes on during play and a lot of back and forth, socially and non-verbally. Yes or no questions that you ask children don't really get their brains thinking critically. If you can, if possible, try and try to use open-ended questions that get them thinking about things on a more complex scale. I know this seems a bit far-fetched at that young age, but really, the sooner you ask them a complex question, it can really help contribute to them learning higher level thinking. It can contribute to them developing higher level thinking skills as they get older. Speech sounds, it's normal for children to mispronounce sounds correctly. At this age, we might not see some sounds fully developed until they 4 to 6 years old. So, but if you notice that at 1 to 2 years they're not saying p, b, and w sounds most of the time, or if you notice they are not saying k, g, t, d, and in words most of the time, it could point to a possible issue with their speech. So what can you do if you notice this in your child? Similar to the last section, you can be a good model. Articulate sounds as best as you can, and if possible, be face-to-face with them when you speak, because when we do speak with our mouths, they can have different shapes for different sounds, as I had shown in that picture earlier in the presentation. So if you can show your face to them while they speak, they could see how the mouth moves in depending on what sound you use. And it's okay, like I said, if they mispronounce things. It's pretty normal in their development. Try to correct them less. Maybe they'll overcome it in time, but just let them kind of go about their business. And like I said, if you do notice these issues, then of course you can get a second opinion. So a certain amount of stuttering is common in early childhood development, but at 2.5 to 3 years old, if they are repeating the first sounds of words such as ball, or if they're stretching sounds out like farm, if they're like farm, if they pause a lot when they talk, or if they have some general trouble saying sounds and words, then yes, there could be an issue with their fluency. Because it is normal to have some stuttering problems at this age, we encourage parents to be patient with children. It's okay if they stutter sometimes, and really the best thing you can do is just kind of let them experience it, and in the same vein, interrupting less. Like if they are trying to communicate with you, that's sort of, I don't want to say a priority, but we want them to develop their expressive language skills. So if they do mispronounce some words, or if they're like not saying words correctly, I think the main goal should be to focus on, oh, they're trying to communicate with me. What are they saying? So try not to stop them too often while they're speaking, and just let them get to the end of their sentence before you try and correct them. So our voices can be affected, when we're sick or if we use them incorrectly for a long time. So Some signs that there could be an issue with voice are if it sounds hoarse or scratchy or breathy, or the child seems to speak nasally, like through their nose. We can encourage children to use their voice more gently. Take care of their voice by not screaming or shouting unnecessarily, and if possible, to help them ask them to monitor their voice levels. You can also see a pediatrician if you notice a sudden change in the child's voice and it doesn't seem to go away. And this is good for all children, no matter, what aspect of development you're in, is just to keep them away from cigarette smoke. Hearing loss. So some signs that a child might have issues with their hearing development is if from birth to 1 year they're not paying attention to sounds. At 7 months to a year they're not responding to their name being called. If at 1 to 2 years they're having trouble following simple directions. Or at birth to 3 years they're having speech and language delays. This could point to an issue with their hearing. As always, we really recommend that children get a newborn hearing screening at birth. This can immediately tell the family whether or not a child has an issue with their hearing. It's just a simple pass-fail. If you think there might be an ear infection or something wrong with their ears, please see a pediatrician first. And after you've done that and still something seems to be wrong with their hearing, then by all means see an audiologist who can do a complete audio evaluation on the child. And we are nearing the end of the presentation. So after all this, we know it's a lot of information to process. To help you put everything together and to answer any questions you may have, Hear Center is here to help you through it. As I've mentioned before, outreach means a lot to us. Before COVID, we were doing our screenings at schools, at senior centers, but now we're really happy to let you know that we're still doing these screenings during the pandemic. A really cool fact is that between 2018 and 2019, we screened over 7,000 infants, children, adults, and seniors. Our program helped many receive care that they sometimes didn't know they needed. So how can we help? So we believe that the earlier you identify any problems with speech and communication, the better. If you have any questions about today's topics or Hear Center in general, you can email me. I'll do my best to answer. But of course, if I need a second opinion, I will reach out to the other speech and hearing professionals that we have at the clinic. If you want a hearing screening, if you want a speech screening, which is a pass-fail test, you can contact me about that. And depending on what the results are after that screening, we can follow up with a speech evaluation, which is not a zero-cost service at Hear Center. So some things you should know about our speech and hearing screenings is that speech screenings will be performed virtually over Zoom to maintain the safety of our clients, staff, and our community. A licensed SLP or SLPA will administer the test, and we'll use different exams depending on their age range. So we won't be doing, unfortunately, any more in-person hearing screenings because that does require putting headphones on people, and just to keep it safe, we're gonna just opt to not do that for the foreseeable future. And we also will not be offering in-clinic screenings. So instead, what we're going to ask you to do, if you think your child has a hearing problem, is to observe the child and keep the following points in mind. So for now, this is what we're kind of doing in place of a formal hearing screening. We're using these self-test questions on ASHA's website. So if you're a parent, educator, or a school staff, if you notice that a child isn't responding to sounds, they don't say many words, they don't have clear speech, they have their devices turned up too loud, they don't follow directions, they say huh or what a lot, they don't answer when you call for them, it could suggest they might have a hearing issue. And as always, if you think there is an infection there or there could be some other medical issue underneath, please see the child's physician first before you come contact us. So also to keep in mind the hearing milestones that we talked about in the early intervention guide, as well as the milestone section. These can all help you figure out if your child needs an evaluation for hearing. So just to kind of give a preview, if let's say your child doesn't pass the screening for speech and you want to do a speech eval. So what can you expect if you want a speech eval at Hear Center? So the child will be evaluated by a licensed speech professional. The appointments will be strictly virtual, like I said earlier, just to keep everyone safe. And it'll be HIPAA compliant, meaning that your personal information will be safe and not shared to anyone. And because we are such a small clinic, at the moment our speech evals are very limited. So if we can get you in, great. But if not, we will do everything we can to refer you out to a different speech therapy group that can offer you a similar level of care. So for hearing, let's say you looked at the milestones, you did the self-test questions, and you went to your physician. And if you think your child does have a hearing issue, then feel free to contact us to get the hearing evaluation. When your child is seen, they will be evaluated by a licensed audiologist using safe, standardized methods of testing. The evaluation will need to be done at our clinic because all of our hearing testing equipment is there. And as of right now, we don't have the means to do a virtual hearing evaluation. Of course, at Hear Center, we have updated our procedures and policies for COVID-19 to ensure the safety of our community and our staff. So if you do come in, of course, masks need to be worn at all times. We'll be disinfecting before and after every appointment, and we are limiting the amount of people who are allowed in the clinic at all times. So those are just some of the measures that we've done, but if you have any more questions about those, feel free to ask us and we'll be happy to explain what we've been doing. And of course, with the evaluation for hearing and for speech, we can explore the results of that evaluation and see what your options are. And thank you that we have made it to the end. I really appreciate it if you've watched the whole thing and you made it with me to the end. I hope this presentation answered some of your questions and provided some clarity about speech, language, and hearing. If you've enjoyed this webinar, please take a moment to fill out our survey down below. This will help us improve for next time, and you have the opportunity there to leave some, critical comments or give us suggestions about what we can do better. So yeah, thank you so much for watching, and if you have any questions, feel free to use this contact info, and have a great day.